Good evening, and welcome to this episode of the Ask Dr. MJ Healthcare Broadcast. We are live in the studios here at Atlanta West Primary Care, and we are here to answer your healthcare questions. We are so glad that you have chosen to spend your evening with us, capturing infotainment, medical information, as well as hopefully being entertained. So we're here. So get ready. Put your questions in the queue. We're going to answer your healthcare questions right now. Okay, so highly good evening, sir. And we're going to do our roll call first. Let's have everybody who's already on. Let's do a quick roll call, and then I'll do my monologue here, what we're going to talk about. And so we want, of course, north, south, east, and west. We want to see people from California. We want to see people from Florida, the Midwest, Chicago, Milwaukee, New York, New Jersey, all of those areas where we typically have our followers from. Okay, so my topic today is going to be Sean Big Time Green, my man. So glad to have you here. Glad to have you here as one of my first male followers, and we really hope that you're sharing this website and this information with your friends and family members. Thank you, Sean. Okay, Sherry Gamble, good evening from Doctor from Dallas, Texas. Okay, Sherry, we are glad to have you back as well. You are a regular, and we appreciate your enthusiasm, which you follow us. Cindy here. Hi, Cindy. You need to know where you're from, Cindy, but thank you so much for tuning in tonight. We appreciate you. Okay, AJ McCollum from Florida. Okay, AJ, that sounds new. I'm not sure whether you tuned in or not before, but if you have, welcome back. If you haven't, welcome too. Thank you so much. Chantel Harper from Macon, Georgia. Okay, Chantel, so glad to have you here. All right, we appreciate you. Hi, Miss Makiba Boland. Great time to see you as well. I enjoyed our last opportunities for fellowship. Thank you so very much. Okay. Thomasine Morris from Birmingham. All right, we got Birmingham in the house now. Thank you so much for being a long time participant in the Ask Dr. MJ. Sean Henry. Hey, Sean, how you doing? So glad to have you here as well. And so we got a good number of men participating tonight. That's what we like to hear. Jackie Marshall, good evening from Virginia. Thank you, Jackie. We really appreciate you as well. Thank you so much for being here with us this evening. Wanda Noes from Chicago. Okay, Midwest is now represented. Wanda, thank you so much for being here with us this evening. Okay. Now, so thank you, Alex, so much. We appreciate that. Tammy Cruz from Columbia, South Kakalaki. Tammy, we appreciate you as well. Great picture right there, those kids. We really appreciate it. We like to keep young people healthy and happy as well. Winnie King from Terrell. Thank you, Winnie. Welcome back. We are so glad to have you here participating and following the Ask Dr. MJ healthcare broadcast. Melinda Harrison. Good evening, Melinda. We appreciate you as well. Thank you so much, Miss Melinda Harrison. Carmen Davis from Cleveland. Okay, we got Cleveland in the house. Midwest still being represented. Thank you so much, Carmen. Melinda Harrison from South Carolina. Okay, Melinda, we got you. Okay, so let's go into our topic right now. Thank you so much for those that have tuned in already, and as people join the show, we'll acknowledge them as well. So great. The question and the topic I talked about that this morning on the Rickey Smiley Morning Show is, how do we deal with this heat? We're having record temperatures across the country, and they are negatively impacting people's health. Did you know that we have had more deaths from the heat, just the elevation in temperature, than we've had from any other weather phenomenon? I'm talking about floods, hurricanes, tornadoes, all of those things lumped together. We've had more people that have died from the heat. And so the question is, and the problem is, how do we avoid that? We want to make sure that you are doing what you can do to avoid, health issues that are heat related. One, your medications. Medications don't tolerate heat well. And oftentimes when a person is on regular medications, they will take their pills and put them in a pill, a daily pill thing. So it'll be Monday's pills, Tuesday's pills, Wednesday pills. They put a week's worth in there. Now, in a controlled environment where everything is, moisture controlled and heat controlled, temperature controlled, that's okay. That's not a problem. But in extreme heat conditions like this, you can start to get deterioration of your medications, in particular if they're touching each other. That can cause, the tablets to stick together. And when that happens, they're reacting on a molecular level and sometimes not in a good way. So it's very important that you keep those pills in the original containers that they came in. That is the best way to keep your medications right now, particularly if you're not able to control the environment in which they're in. This is not the time to have your pills in your car's dashboard, under your car's seat, in your car's glove compartment. None of those things, those are not good places for your medications right now. Let's start with the simple things. Insulin. If you're a diabetic and you're on insulin, you already know you have to keep that insulin cool. But a lot of people, particularly people with pen injectors, they push the envelope as far as trying to control the temperature of those pens. But even if you're drawing your insulin up out of a bottle, at this point, you really need to keep that insulin in a cool pack. It doesn't have to be on ice. You don't want to freeze your insulin, but it needs to be kept cool and taken out of that hot environment as quickly as possible. So there are people that work in environments that are uncontrolled. I know I have people, say, for instance, that drive UPS trucks under the current contract. Those trucks don't have air conditioning. Now, the new contract they just signed, they're going to have AC, but it's going to be a while to correct that and to change the fleet. So in that situation, if a person is keeping their medication in their work truck while getting through their workday, it's going to have some problems and it's probably going to deteriorate. Now, so you got your medicine, you're keeping them cool, but what else can happen? In addition to the heat, some of the medications can affect your ability to detect heat and control your body's temperature. So for instance, blood pressure medications, antihistamines, or even some psychiatric medications can change your body's response to heat, make you heat intolerant, or make your body not be able to adjust the way that it is. And again, for instance, diuretics, which are used commonly to control your blood pressure, can help, particularly if you're sweating a lot, cause dehydration. Dehydration state your blood concentrates anything that's in the blood. So say, for instance, you're taking a psychiatric medication. A good example for bipolar disorder would be lithium. Well, you get concentrated, dehydrated, those lithium levels can shoot up to a toxic level. At a toxic level, lithium can cause cardiac arrhythmias, or heart problems, a heart attack, or a stroke, seizures. It can even put you in a coma. So it's very important that you stay hydrated. By the time you feel thirsty, you're already behind the game. So you need to stay on top of this and start drinking. If you know you're going to be in the heat, prep yourself by starting off drinking water before you get in that environment, and continuing to drink water on a timed basis, regardless of whether you feel thirsty or not. Because if it's hot enough for you to sweat, you can sweat a couple of liters of fluid out without even knowing it, without even thinking about it. So that can be a major, major problem. So the two stages of heat-related illnesses, one is heat exhaustion. Under heat exhaustion, you get tired, dizzy, you may have a headache, you just don't feel right. And you start having very profuse sweating. Under those circumstances, it can be a big, big problem with the sweating. Now, so when you have that, you need to just basically cool yourself down, go into an air-conditioned building, an air-conditioned room, stop doing what you're doing in the heat, get out of the sun, get into the shade, and hydrate. Drink lots of fluid, and there's no substitution for water. A lot of these energy drinks, as well as sports drinks like Gatorade, Powerade, etc., they are good for replacing electrolytes, but some of them have so much sugar in them. They have more sugar than Coca-Cola. So it's very important that you realize that these may not be the perfect or the best substitute for you. Nothing is better than water. Water is ideal. So you drink water, lots of it, stay hydrated. If you do not do that, if you start to show signs of heat exhaustion, that can rapidly progress to heat stroke. Under heat stroke, now you start to have mental confusion because blood is not, you're so dehydrated, blood is not getting to your brain. So your brain is suffering. So you start to have hallucinations, or you're just disorientated, you get dizzy, you can lose consciousness. But more importantly, your organs, your internal organs are not also getting enough blood. They're shutting down in real time. And your heart, your kidneys, your liver, all of these things can really go bad very, very quickly. And a heat stroke is life-threatening. I mean, it is a medical emergency of the highest nature. So how do you treat that? Well, the first thing you do, you hydrate the person. If they can, if you can get the water in them, you have them drink as much as possible. But you have seen situations where they literally would take a person and put them in an ice bath, trying to rapidly cool their temperature. If not, if an ice bath situation is not available, then you can pack that person in ice, particularly putting ice in the groin, where you have large blood vessels, under the arms, where you can help cool the core down very, very quickly, behind the neck, etc. So be conscientious. Check on your elderly people who may or may not have air conditioning or may not use air conditioning because they grew up and air conditioning wasn't a necessity, so they deal with the heat or think that they can deal with the heat. But these are unusual times. Under these circumstances, under these times, we have problems that are amazing. So if you these temperatures are, this is the hottest summer in the history of recorded history. So we need to make sure that we're preparing ourselves in doing so. So thank you very much for allowing me to tell you about heat exhaustion, heat stroke. And now this is your show. We're at the Ask Dr. MJ phase. And one thing I want to do is introduce you to, we have a new lipo product, Lipo Night. This is a nighttime fat burner. And what this does in conjunction with our other weight loss products, such as the Lipo Drops Maximum Strength and the Keto Max, the Lipo Drops Night allows you to burn fat while you're sleeping. It also has some other good things in there to help with your sleep, like melatonin. So this is a phenomenal product that has just been introduced. And since it's a new product that's being introduced, there's a special going on. So go to the website right now, lipodrops.com, and look for the new Lipo Night. Find out about Lipo Night and see how you can enhance your weight loss even further in doing so. So Dr. Collier has now, remember, I had lost 30 pounds and gained a few pounds back. I'm now about 35 pounds down, and I'm trying to just sustain right now. I don't want to lose any more weight. I'm very comfortable with this weight, with this BMI, and I'm very happy with the weight loss. It has been amazing as far as how my energy level is up, how I did have to go buy new clothes. Some of my clothes were so baggy on me, I looked a little out of place, like a kid trying on his parents, or like a little boy trying on his father's suits. And so I had to buy some new clothes, but that's a good problem to have. It's time to update a few of the suits anyway. So let's go to the questions, Habit. Let's put them in the queue right now and answer your healthcare questions. Okay, Faith Creel, my lips have suddenly become dry and I developed a dark spot on my bottom lip. I keep it moisturized twice a day. What could this mean? Well, if your lips are drying out, that means you're probably dehydrated. If your gums, if you smile, big smile like this, and your gums have gray spots in them, or that your gums are gray versus having pink gums, that is just pigmentation. And that pigmentation element is something that may have been there and you just noticed it because your lips were dry, or it may be new, but it does happen. And you will notice that in people of color, they can have this hyperpigmentation. It can be in the palms of your hand, the soles of your feet. It can be dark skin becoming darker. You'll see those spots. But if it's an isolated lesion, then you might want to have it evaluated and looked at by somebody who knows what they're looking at, culturally sensitive healthcare. This is probably not something that people will go all out and say, oh, we're not sure what this is, you need to get a biopsy and all that. No, it's probably not that situation. Common things happen most commonly, but particularly since you describe your lips suddenly becoming dry, that is a key indicator that you are not drinking enough water. So make sure that you're drinking enough water and use a lip moisturizer, not just a wax covering. Some of the chapstick products are just wax coverings. They make it look better, but they don't really moisturize. So the liquid lip glosses, so to speak, or the liquid Blistex, those sort of products may be better for you. But more importantly, make sure that you're drinking at least 8 to 10 glasses of water per day. Everyone thinks they're drinking enough water. No one is drinking enough water. And also, there's no substitute for water. So you can't say, well, I had coffee, I had juice, I had tea, I had soda, anything else. Nothing substitutes for water. But what you can do to compromise when you're drinking anything other than water, you also get a glass of water and you drink that glass of water to its conclusion. And before you get a refill on whatever your primary drink is. So if it's tea, if it's juice, if it's soda, if it's Jack Daniels, whatever it is, you finish that, you finish the glass of water, you get another one, you get another glass of water. So that way you can stay hydrated. It also helps prevent you from getting, if you're drinking an alcoholic beverage, your brain gets dehydrated, which is the mechanism of a hangover. So if you stay hydrated, you will not feel bad the next day and you could have had a good evening that night. Thank you, Faith. That was a great question. Okay. Kenya Pierre. I'm 41 with a blood clot on my left leg. Currently on Eliquis blood thinner. There's something I can do to make sure it doesn't travel to my lungs. You're on the Eliquis, and that is going to, the blood clot has to go through its progression and regression. Your body will dissolve the clot. It has to do that. The Eliquis basically make sure that your blood is thin, the clot doesn't get bigger, and you don't get new clots. But the clot, the main clot, is not dissolved by Eliquis. It has to go through a process where it will be, where your body tunnels through it, you get blood flow again, and then the clot will resolve. It can, and rarely does, but it can break off, as you stated, and go to your lungs. And so if that's the case, I would wear some support socks, or in this situation, some serious compression socks to hold that clot in place so that it doesn't slide up there. Oftentimes, if you are successful with the clotting, it will come after sitting for a long period of time. That can be a road trip, it can be a plane trip, it can be a train trip. But if you're sitting down for more than 2 hours, you need to get up. If you're on a plane, you get up and walk up and down the aisles of that plane to get your legs moving. Because the mechanism of walking, as you walk, you have a heel strike. Your heel lands first. You roll up in your foot as it flattens out. You get on the ball of your foot and you push off. That action literally milks fluid out of your leg and pushes that fluid back to your heart, which is where you want it to go. If the fluid sits there, when blood is not moving, it clots. That is the nature of blood. It's what it's supposed to do. That's why blood has to keep moving. So Eliquis is a good product. Make sure you're taking it. The standard dose is 5 milligrams 2 times per day, roughly 12 hours apart. And you're going to be on that for probably a minimum of 3 months, sometimes 6. It depends on the nature of the clot. If you ever have another clot for whatever reason, then you're going to probably be on the Eliquis or something like it for the duration. They also are probably going to suggest that you have an evaluation by a hematologist, a blood specialist, to make sure that you don't have a genetic predisposition to clotting. I see you have no family history. That's good. But they're going to evaluate you for that. That's kind of the standard option now. So don't be afraid or frightened. Hematologists are also usually hematologists, blood specialists / oncologists, cancer specialists. So blood clots are not cancerous. They don't predispose you to cancer. They are not cancer causing. So, but I've had patients that when they were referred to the hematologist and they saw cancer patients in there and they saw oncology on the door, they thought they had been misled, that they had cancer, nobody had told them, or they were just frightened. So don't be frightened. The hematologist is what you need if they refer you to them. But blood clots do happen. Eliquis is the therapy, so you're being treated appropriately. But if you're not wearing compression socks, I would wear them on both legs, not just on the leg that you have the clot. They are readily available at any drugstore that sells durable medical equipment, or DME. Most of the larger drugstores do that. So if they have canes and crutches, they probably have the stockings as well. You can get them almost anywhere and get ones depending upon where the clot is in your leg. If it's in your lower leg, just get socks that come up to your knees. If it's in the higher part of your leg, you need thigh highs. Okay, great question. Can you please let us know how you do? Okay, Lawrence Fisher, how long should I take the male enhancements? Lawrence, you can take the male enhancements every day for the rest of your life, as long as you need them. The great thing about some male enhancement products, I'll speak particularly on the Lipo-T product, is that it enhances you and it makes your body work better. So you can literally take it every day. It's the Lipo-T. You take 2 capsules or 3 capsules per day, depending upon your level of dysfunction and how much you need. But I would say the maintenance probably would be 2 capsules. You probably don't need to stay on 3, because once you have fixed the problem, so to speak, the 3 is just extra. It's not going to harm you, but it's not going to help you anymore. And each bottle has 90 capsules in it. So if you take 2 to last you 6 weeks, you take 3, it's only going to last you a month. And so you can stretch it out as well. But Dr. Collier is a long-term user and highly endorses that. But there's no reason to not take it, but you also don't have to take it. Once you have started taking a product like the Lipo-T, you develop a level of sexual physical fitness. And in that physical fitness is just like going to the gym and working out. You get big muscles, you're able to do better. And so you may not feel like you need it, and you might not. And as long as you're able to operate at that level, you don't necessarily need supplementation or enhancement. But if you do, then there's no downside to taking it. Now, if you're speaking of other types of enhancement, such as Viagra, Levitra, Cialis, again, once most people start taking them, they like the way that they make them feel, and the way that they make them operate, and so they will take them. But there's no time frame on it. You don't have to say, well, I've been taking this for months. I've been taking this for years. I need to stop taking it. There's no downside to doing that. You can continue the product as long as you desire or think that you need it. Great question, Lawrence. Winnie King, okay, from Terrell, Texas, taking vitamin DK2 better than vitamin D3. No, the vitamin DK2 has a vitamin K and D2. D2 is inactive vitamin D, which has to be converted to vitamin D3. Vitamin D3 is the active form, and if you're taking vitamin D3, then you already have the active form. Some people's body will convert D2 to D3 very efficiently and very effectively. Other people's bodies don't do it well at all. And if your body doesn't do well at all, you can take as much D2 as you like, and you're just not going to have any real benefit from it. Some people add vitamin K to it, and that is a great product. As a matter of fact, we had a Doctor's D product, which is our vitamin D3 product, that had vitamin K in it. But people that have problems with clotting, or if their blood is too thin, or if they're taking blood thinners, they cannot take vitamin K. So we just decided it would be better to just use the D3. It's a great product singularly. So it's not, I would say, there are combination products with D3 and K that can be taken and do have benefits. But if you have any issues with blood thinning, or you're taking a blood thinner, or if you're taking anti-inflammatories like Motrin, Advil, Aleve, Naproxen on a daily basis, or taking them for arthritis or some other issue like that, taking that along with the vitamin K can cause bruising and other bleeding problems. So I would say you get probably all the benefit that you need with the vitamin D3, but there are some clear indications at times when a combination of D3 and K can be what's indicated, and it's a good product as well. But the D2, again, I would say is a lesser product than D3. So I would get a D3 combination along with the vitamin K if you like. Great question, Winnie. And Kennedy, if your A1C has been low under 6.5, but it's now 6.5, can you lower it by diet and exercise, or should you take medication to get it lower? Well, and it depends. If you have metabolic syndrome is a combination of high blood pressure, high cholesterol, and diabetes. Technically, a hemoglobin A1C of 6.5 is diabetes. Less than 6.5 is pre-diabetes. But if you've been under 6.5 and now you've graduated to 6.5, you still quote pre-diabetic now going into diabetes without question. So you can possibly do it with diet and exercise, but you have to really be conscientious and committed to it. I usually would take a patient when I've seen progression in that manner, and place them on at least the first level therapy, which would be metformin. Using the metformin has no downside. It gives your pancreas an opportunity to rest and prolong the onset or prevent the onset of full-blown diabetes. And you get the hemoglobin A1C back down. You might be able to keep it down with diet and exercise. I do the same thing with my patients with hypercholesterolemia. I say, let's take medicine for 3 months, get your cholesterol really far down, and then see if we can keep it down with diet and exercise versus just using diet and exercise, rechecking it in 3 to 6 months, and it hasn't changed or it's worsened. Because if it does not come down, damage is being done, and you're on a time clock here. So, but if you take the medication, get it down, then I would retest, see if I can keep it controlled with diet and exercise. But if not, again, embrace and accept the fact that medication may be required. And so if it is, the decision is to take medicine or not take medicine. Once you get to the point of I need to take medicine, then you take a therapeutic dose. Some patients will say, well, I'll take it, but give me the lowest dose that you can start me off on. And that's not appropriate. What is appropriate is to start you off on a dose that will give you the benefit that you want. So it doesn't matter whether it's 250 milligrams, 500 milligrams, 750 milligrams, 1,000 milligrams. It's still one pill. So you take that, but you want a dose that's going to give you the benefit, and that's where you are with that. So I would partner with my primary care doctor, family physician, internist. If you're under the care of an endocrinologist, this is really not an endocrinology level problem right now. It's just a question as to whether your doctor wants to deal with it and feels comfortable dealing with it. But sounds like you've already had this discussion. So yeah, I would say my recommendation would be go ahead and start taking the medication. There's some great things out there that you could get if you need to lose weight. And now that you meet that criteria, you might qualify for medications like Ozempic or Mounjaro, which will really knock your A1C down quickly and make you drop 20 pounds. So things that you might consider in your treatment options. Thank you, Ann. That's a great question. Okay, Ava's good one. I'm a 59-year-old female diagnosed with sciatica because of leg pain. Prednisone, cyclobenzaprine, which is Flexeril, a muscle relaxer, and diclofenac didn't help. Mornings are the worst for pain and stiffness. What to do, what to do. Back pain / sciatica, the number one complaint in the doctor's offices, because as we age, particularly African-American females who have God's gift of hips and thighs, it is very important that the ergonomics of your sleep posture, and you just described perfectly what happens. If you sleep on your side, your hips are tilted, it's going to aggravate the sciatic nerve. So when you wake up, you have been straining that nerve and insulting that nerve all night. So it gets you back in the morning when you try to walk around and do that. So range of motion exercises, the primary therapy is anti-inflammatory, muscle relaxants, and physical therapy. So you're on all of those things. You just need to do some therapy to stretch it out. Chiropractor are great with sciatica, and so that may be a good option for you as well. Meet and greet your friendly neighborhood chiropractor. You may have to start off going to see them maybe 3 times per week for a couple of weeks, and then after that, a maintenance program once every 2 weeks, or even as little as once a month, because this problem is not going to go away, but you can control it and keep it under control. But if you don't, it will get worse over time. And then the doctors will start talking about operating on your back. And no one is operating on Dr. Collier's back or neck, unless 1, I cannot walk. 2, I cannot control my bowel or bladder. 3, I cannot get an erection and do what men do. That's my criteria. Other than that, if it's just hurting, anti-inflammatories, muscle relaxants, pain medications, physical therapy, massage, Tai Chi, yoga, whatever it takes to get me through the day. But surgery is your last and final option, and we don't want to get to that point. It doesn't sound like you're there yet. But again, chiropractic manipulation may give you great relief, and oftentimes people will do that, get relief, but they don't continue it. So it comes back, and then they say, well, I went to the chiropractor and it didn't work. Well, it did work, but it doesn't sustain. It requires continuous manipulation and straightening out of that spine. But if you have hips and thighs, which Black women do have, this is a good thing. Your sleep posture needs to be flat on your back with something in the small of your back to support your back. It can be something as little as or as simple as a rolled up towel. You take a towel, fold it into thirds, roll it up about halfway, put the flat part under your butt so you won't move, and keep the rolled up portion under your back. Try that, see if that gives you some relief. That answers the question. Then if you want to, you can purchase a more elegant back support system. But sleeping on your side or sleeping on your stomach is now a no-no. So you're going to have to try to change your sleep posture, which is very difficult to do. I literally fight with this concept every night. I try to stay flat on my back. I've got an adjustable bed now where I can lift the head up about 15 degrees. Makes it very difficult to sleep on my side or on my back, on my stomach rather. So I can sleep on my back comfortably, but I really haven't been a stomach sleeper all my life. Now it's difficult to change that, but it does. It makes my back feel 1,000% better when I do that versus when I don't. So great question, Avis. I hope that helps you. Vicky Buchanan, I've been dealing with my feet and legs swelling to the point that it hurts to walk. My doctor says I have a circulation issue going on. What can I do? What type of doctor do I need to see? So you possibly need to at least have vascular testing. The first test is an ultrasound of the veins and arteries of the leg. And then after that, there's some even more invasive tests, angiograms, if you need that, to see if you have any compromise, usually cholesterol plaquing in your legs, upper or middle legs. It can even be cholesterol plaquing in your aorta, which is in your stomach, but it's where the blood vessel spreads blood to your legs and lower extremities. So you can have peripheral vascular disease that can be treated and needs to be treated in a variety of different ways, starting off with simple things like compression socks or support socks, so that that closes the space on your legs so that you do not have a place for the fluid to collect. If your job has you sitting all day, if you're sitting at a desk, every 2 hours you need to get up and take a few laps around that desk or go for a walk. As I talked and explained earlier, walking takes the fluid out of the legs. Sitting allows gravity to let that fluid collect. At night, when you are lying down in the bed, you need to put a rolled up towel or pillow underneath your knees so that your legs are flexed about 15 degrees instead of that leg being straight like this. I've seen people that have taken the leg and they put a pillow underneath their feet and they elevate their legs that way. Well, when that leg muscles lock, the fluid can't drain. So you need to make sure that you are bending your legs so that your knee is bent about 15 to 30 degrees. That relaxes the muscles and allows the fluid to drain overnight. So if you're in a situation where your legs are puffy during the day and you go to sleep and when you wake up in the morning, your legs they'll shrink back down to normal, then that shows you, clearly demonstrates that this problem can be addressed. If your legs are puffy and all the time, no matter what your posture is, then it's going to require a little more aggressive therapy in doing so. But this is a problem. As soon as you start working on it, the better your outcome would be. Once those tissues in the legs and feet are stretched out, they're like a sponge or like a spring. Once you stretch them out, they'll never go back to their original size. So they may get down smaller, but they won't get down to the spot that they were previously. So now, before you know it, they're stretch out, and you got fat ankles. Then you have fat ankles that rolling over your shoes. Shoes don't fit, your feet hurt. Then it starts to move up your legs. So before you know it, you got fat ankles, and your legs and knees are swollen as well. It can even go all the way up to your buttock. But for most people, it starts off with the ankle and feet. They call that pedal, P-E-D-A-L, edema, and then it moves up the legs, and that compromises the circulation, predisposes you to blood clots, and again, the cosmetic thing. You get the varicose veins that are not cosmetically attractive, and again, they cause circulation problems. So you need to work with a vascular surgeon or a vascular specialist in that. Or a podiatrist. Most podiatrists can work with you in doing so, a foot specialist. And if it is beyond their level of expertise, they'll refer you to a vascular doctor. There are specific clinics that deal with this issue. You've seen the Vein Clinics of America as one name, but there are many. You can just Google cardiovascular disease, peripheral vascular disease, varicose veins, any of those things, and they'll start directing you down the path that you need to be evaluated. Okay, great question. Anita Jordan from Mississippi. Is collagen good to take and how much is required? Collagen is great. Collagen is the infrastructure, the framework of your skin. And so if you have low collagen or thin collagen levels, your skin is saggy, your skin doesn't look as healthy, you get wrinkles and all kind of other problems. If you have a good collagen matrix, you look younger, your skin is not sagging, you don't have a double chin, all kinds of good things. It also helps with joint health as well. So collagen is good depending upon the manufacturer. It will tell you which collagen product to take, because there are other additives that are in there that determine what your actual dose would be. So I would just do a little research, ask a pharmacist for their recommendation, or go to a place like GNC or the Vitamin Shop and ask one of the counselors in there about collagen and what they would recommend, and then listen to what they have to say and purchase what you need, possibly even from somewhere else. But collagen is a good supplement. A lot of people take it, particularly if skin and musculature are challenges for you. Okay, great question. Daryl, I had prostate cancer. I'm so glad to say. And the doctor had to cut the vein, so he told me that I would not be able to maintain an erection. Will Lipo-T help? Daryl, it depends. Most people, when they have prostate cancer and they have a procedure called a radical prostatectomy, it's not the vein that is the problem. It is the nerve that is the problem. So everyone wants to have what's called a nerve-sparing prostatectomy. A nerve-sparing prostatectomy. The problem is that the nerve is not in the same place in everybody. It's just like if you look at a person's arm and you see veins, the veins in some people are totally different than veins in other people, and that may be the situation with you. So when he says he had to cut the vein, I'm not sure how that would affect your erection, because it is arterial blood flow that causes an erection, and your penis fills up with blood from the penile artery. There's a gate that's kind of like the Panama Canal. It closes and holds the blood in the penis. You have sex, when you ejaculate, that is the signal for that gate to open. When that gate opens, the blood comes out and you lose your erection. So for all the men that say, oh, I can go all night, I can do this, you can't, because as soon as you ejaculate, the gates open and you lose your erection. It happens 100% of the time. There are products, again, some of the PDE5 inhibitors like Viagra, Cialis, Levitra, they keep that gate closed even after you ejaculate. So you can have sex again if you like. And most people, though, even if you take a break, you'll lose your erection, but it'll come right back. So that's a good thing about those types of products. They do give you an opportunity for a round 2 or a round 3 sexually. But again, cutting the vein, I'm not sure how that works. You might need to get them to explain a little more to you, particularly since the doctor said he, quote, had to cut the vein. I'm not sure exactly what that means. But the bottom line to your question is you can try a product like Lipo-T. Lipo-T's primary function is to help with libido, your desire to have sex, and your testosterone level to make your body naturally enhance your sexual desire and sexual functional ability. That is the natural phenomena. If you have a plumbing problem, then that plumbing problem might need to be addressed, and it's possible it can be surgically repaired if it's possible. If it's still there, they can bring those two ends together. A vascular surgeon can fix that. So it's possible that you might be able to do that. But after having had prostate surgery, it takes a while, sometimes a year or two, for you to all of a sudden be able to have good erections again, and the erection strong enough to penetrate a woman's vagina and optimize your sexual desire. That can happen. A lot of doctors now are placing patients on a daily dose of Cialis. The intermittent dose, the one you take when you feel like you need it, is 20 milligrams. The daily dose of Cialis, or tadalafil, is the generic name. It's 5 milligrams. You take that every day, regardless of whether you're trying to have sex or not. And that helps stimulate an erection. Now, the great thing about the human body is you can cut veins everywhere, and your body has what's called collateral flow. It creates another pathway to get blood where it needs to go. So your body can do that. It just takes a while. That process called angiogenesis, or the creation of new blood pathways, can happen as well. So it just may be tincture of time. So this is a time for you to really spend some quality time communicating with your urologist. Again, ask about the daily dose of the Cialis and try the Lipo-T. See if it helps. It can't hurt in this situation. It can only help. If it does help, great. If it doesn't, you're no worse off than you were. But I promise you probably will get benefit beyond just getting an erection. I think other benefits are there as well with that product. Thank you, Darryl. Great question. Kyla Controls, if someone's vitamin D is 66, how much vitamin D would you recommend to raise it to 150? The normal range on a vitamin D is 30 to 90 nanograms per mil. This unit of measure is not appropriate for vitamin D that you have listed here. So ideally, you want to get it between 30 and 60. If that's just a typo and you really mean nanograms per mil, which would be NG/ml, then 66 is a great number. You don't really need to try to push it. You definitely don't need to push it to 150. That won't harm you necessarily, but it could predispose you to things like kidney stones. So I like to keep, again, a normal range on the vitamin D, 30 to 90. If you're less than 30, and most people are, they're not in a therapeutic range. That means you have weak bones, weak teeth, bad skin, bad hair, and your immune system just cannot function appropriately, because vitamin D is a very important part of immune function. So you take the vitamin D, the recommended dose is 5,000 international units per day. 5,000 international units per day. You get that vitamin D to 40. At a vitamin D level of 40, now you have optimal immune function, and your body becomes an unfavorable environment for infectious pathogens. So that means viruses like the flu and the coronavirus, the COVID, bacteria like strep throat and pneumonia, fungal infections like toenail fungus, jock itch, vaginal yeast for women. Your body just does not provide a favorable environment for those pathogens to thrive. So you usually won't get those infections. If you do get them, they will be self-limited and mild. Now, if you get that level up to a higher level, say around 60, now you start to get, and there are many, many studies that show cancer prevention, i.e. colon cancer, prostate cancer for men, breast cancer for women, pancreatic cancer. Multiple cancers have been shown to respond to vitamin D therapy. the first thing that happens if you get a cancer diagnosis, despite any other therapy that you get, chemotherapy, radiation therapy, etc., the oncologist is going to put you on vitamin D at high doses to help slow down the growth of that cancer. But if you already have a good vitamin D level, you're not going to have the issue with the cancer. So it's a great, very elegant and simple way to help decrease the chances of your body getting a cancer. Now, there are other factors, if you're smoking, if you, drinking excessive alcohol, if you got a, family history, everybody in your family gets cancer, then that's different. But for all the advice I give you is for regular people, not outliers, not people who have some unique circumstance, but for regular people who just are walking around with low vitamin D, like 9 out of 10 people in the United States are. Vitamin D supplementation has major benefits to preventing infectious diseases, again, viruses, fungi, and bacterial, and cancers, prostate, colon, pancreatic, cancer of your female organs, ladies, which would be your ovaries and your cervix. All of those things are great benefits from that. So, Kayla, just get the vitamin D product that we have, the Doctor's D. Take a 5,000 international unit dose. It will get you in a therapeutic range. You can monitor it if you like. You probably won't have to, but if you want to, I check my patients' vitamin D levels every 3 months to make sure that they're sustaining. And if they're taking the product, don't get fatigued from taking it. Make sure you're taking it every day, and you'll benefit. If you have a really bad deficit, if you're under 10 or can't even measure your vitamin D, then I have you take a total of 10,000 international units daily for at least 6 to 12 weeks. And then after that, maintain with 5,000. So vitamin D, again, very elegant way to enhance your health and your physical condition. One of the things that are in Dr. Collier's Healthy Trio, that trio being vitamin D at 5,000 international units per day, omega-3 fish oil at a dose of 3,000 to 4,000 milligrams per day, and probiotics. Probiotics that contain multiple cultures in the colony forming unit measure of billions with a B. Billions of colony forming units with a B, not millions. Okay, great question, Kayla. Olifacon, how do you know if testosterone therapy is right for you? What are the signs? I'm 50 plus on metformin and blood pressure meds. One, get your testosterone tested. It's a routine blood test that you can check. But if you want to take a product like the Lipo T, it will allow your body to optimize your testosterone without you really having to start. It doesn't matter what your starting level is. It will get you to a better level. So if you want to do that, you can. I tell patients that there are multiple stages of testosterone replacement. Most of the men that I test have very low testosterone. The testosterone level should be between 300 and 900 in most laboratories. Some go down to 250, but routinely 300 to 900. I had men today, 140, 170. Just very low levels of testosterone, decreased libido, poor erectile function, but other things, not sleeping well, not lack of energy, all kinds of things. So you can start off with a product like the Lipo T to help your body naturally make more testosterone. You can take testosterone injections. The injection regimen can vary, but most men will tolerate a 200 milligram injection of testosterone cypionate once a week. I will do that for, say, 4 to 6 weeks, then recheck the levels, and depending upon how your body sustains those levels, see if you need maintenance therapy. Some people need a shot every 2 weeks. Some people need 1 shot a month. Some people go through the original treatment program, 4 to 6 weeks, and never need another shot again. Again, some people start out taking the pills and taking the shots, but the optimal way is bioidentical hormone replacement therapy, or BHRT, which is a procedure that I do perform in my office as well. You get hormone pellets, particularly testosterone, inserted under the skin into the fat layer surgically. The procedure takes about 10 minutes, and it will last 6 months to 1 year, sometimes longer. That is the equivalent of the fountain of youth. It makes you look better, feel better, sleep better, act better, you name it. It addresses so many different health concerns in doing so. So Google bioidentical hormone replacement therapy and see if that sounds like it might be what you need. But again, you're 50 plus. You can start off always with a product like the Lipo T, and then see how it makes you feel. If you feel like you need more, and one of the biggest side effects of diabetes, and you're on metformin for your diabetes, is erectile dysfunction. Oftentimes, it's the way that people are diagnosed with diabetes. They never get their sugar checked, but once they no longer can function sexually, they come to the doctor and say, hey, doctor, I'm having difficulty getting and maintaining an erection. Doctor checks the blood sugar and the A1C and confirms that they're diabetic. So you correct and treat the diabetes. You never go outside of the primary disease state. Blood pressure and diabetes alone are very big challenges to sexual function. So you need to make sure that your blood pressure is controlled as well as your diabetes. You get those things controlled, then you might not even need any kind of testosterone supplement. But if you do, again, it will work better and last longer if you had a two primary disease states controlled. Now, if you have diabetes and you're on blood pressure medication, you should also be on a cholesterol-lowering medication as well. Because if you got those two, you always have the third one, high cholesterolemia or hyperlipidemia, and you need to be on a statin class drug. That is the recommended therapy and for metabolic syndrome. That's what you have. It's a triangle of diseases. It's high blood pressure here, diabetes in one corner, and high cholesterol in the other corner. Those three things have to be balanced. If one is not controlled and it skews the angle of the triangle, you'll never get the other two optimized. You will not get good control of the disease state. So you need to make sure that your angles are perfect and that you're controlling each of those disease states to optimize your function sexually. And again, testosterone supplementation may be appropriate as well. Okay, great question. Carmen Davis, good evening. As I was on Mounjaro, my insurance would no longer pay for it. My doctor just started me on Wegovy. Can you explain what the difference between the two is? Okay, both of these drugs are what are called GLP-1 inhibitors. Mounjaro operates at two receptor sites. I think it is a more potent and better molecule, but the Wegovy is the same medication as Ozempic. Wegovy, if your insurance is covering one of them, then that's good. Again, if it's not covering the Mounjaro and it's cost prohibitive, and the cost for these medications is about $1,600 to $1,800 per month. That's $1,600, $1,800 cash pricing. So those prices are out of the budget for the vast majority of people. So if your insurance isn't covering it, and when Mounjaro first came out, they had coupons. You could literally get it if your insurance covered it for $25. Those coupons have expired, and I don't think they have any desire to bring them back because people are buying it at full price. So I don't think there are going to be any discount programs for the Mounjaro in the future. But Wegovy, which is the exact same drug as Ozempic, steglipin. So it is a medication that works on one receptor. It does a couple of things. It gives your body a sense of satiety or fullness, so you feel full. Two, it literally decreases your appetite, and it changes the way that insulin responds to taking in food. So you're literally just not hungry, and you really have difficulty eating a lot. If you try to eat around it, as you know, you get nauseated. If you keep eating, you're going to get nauseated and vomit. So most people will subside to that and just not eat as much, and the weight loss is absolutely incredible with them. So Wegovy's indication is purely for weight loss. Ozempic's the exact same drug made by the same people, just with a different indication. When they applied for FDA approval for these medications, they decided to give Wegovy the strict weight loss indication and Ozempic the strict diabetes indication, which lowers your blood sugar, lowers your hemoglobin A1C, but also causes a phenomenal amount of weight loss. So now they're actually trying to go for a weight loss indication only, or in addition to for the Ozempic. But it's the exact same medication. Ozempic is just the name that you've seen and heard on the commercials, and so more people are familiar with it. But literally, it's made by the same people. It's just if it goes down the left side of the assembly line, they call it Wegovy. If it goes down the right side of the assembly line, they call it Ozempic. But both work very effectively, and if your insurance is paying for the Wegovy and you're getting it covered, then that's the one that's probably going to work for you. You add a middle dose, it can be higher than that. And if you need, but a lot of people get benefit just at the 0.5 milligram dose. If you need a higher dose, if you start to plateau and you stop losing the weight on it, then you could probably go up to 1 milligram. They actually even have a oral version of these medications as well. So that oral version you take on a daily basis, and it gives you the same benefit. And they're actually going for The dose of that is, you start off from 3 milligrams, you go to 7 milligrams, then 14 milligrams. They're looking at FDA approval of a higher dose to enhance its weight loss capabilities. So Carmen, good job. I'm sure you already responded quite successfully to Mounjaro, but the Wegovy will keep you going on your weight loss journey. You can also supplement with our Lipo Drops maximum strength formulation. 1 dropperful under your tongue before each meal, and you will find that you will get even better results because you want to optimize your fat burn and not lose muscle. This class of medications has been noted to make a person lose muscle as well, and you don't want to lose muscle support. You don't want to become weak and fragile. So it's very important that you maintain your muscle mass, and that's one of the things you could do by supplementing with the Lipo Drops maximum strength formula, because it makes your fat burn, it makes your weight loss predominantly fat, and so that's the benefit that you want. In conjunction with that, and I have people in my weight loss facility that are using both products and having great success. And with our new nighttime Lipo Night, you can even optimize that even further. Burn fat while you're sleeping and just really get your sexy back. Decrease your body's fat cell layer, and then you're going to get muscle definition without doing a single crunch in the gym or without doing any real exercises. You're going to look fitter because the muscles themselves will be what's showing and not the fat layer over the muscles. And so you want to make sure that you're not losing so much that your skin starts to appear that it's loose. And that's one of the benefits as well of taking the supplements in addition to the GLP-1 inhibitors. Okay, great question, Carmen. Do the Lipo Drops help with sarcoidosis? Lipo Drops are for weight loss. Sarcoidosis is an inflammatory condition. Now, being overweight is an inflammatory condition. If you decrease your weight, you're going to decrease your inflammation, which is going to help with any inflammatory condition, including sarcoidosis, arthritis, any of those problems. So directly, no, it does not. But indirectly, weight loss will help with so many different conditions, everything from back pain to depression to headaches to joint pain, you name it. So sarcoidosis, which is inflammation and sarcoid plaques are deposited in the muscles. They can be in the lungs, in particular if you have breathing problems. You can have sarcoidosis of the lung, but it can also just be of the skin peripherally. It can be, kind of throughout your connective tissues. So, but you get inflammation. It's an inflammatory disease state. If you decrease inflammation, you're going to have improvement with that. So that's a roundabout way of saying, yes, it can help, but I don't want you to think it's a direct effect. It is just kind of a benefit of the weight loss that you obtain with the Lipo Drops. Great question, Linda. Deborah Chapman, I started taking the Lipo Drops. I wanted to know how long should I wait to eat after taking the drops. You can eat immediately. You put the drops under your tongue. They're absorbed. It's almost like taking an injection. And so it's literally absorbed under your tongue in a matter of seconds. But I just say hold it under your tongue for 2 minutes. Once you swallow it, it's not doing you any good in your stomach. Its function and its niche is being absorbed under the tongue. The best analogy I can give you, if a person's having chest pain and they take nitroglycerin, they put it under their tongue. The tongue absorbs that so quickly, literally equal and compatible to getting an injection of the same medication that it's going to, you see the person put the nitroglycerin under their tongue, and within a matter of seconds, the chest pain is gone. Well, when you put the Lipo Drops under your tongue, it's absorbed in a very, very short period of time. So you don't have to wait 15 minutes, 30 minutes, etc. You can do that and do it. You can squirt it under your tongue and then proceed to eat your meal. You can do it before you eat it. You're preparing food and you say, okay, it's going to take me 15, 20 minutes to cook this. You can use the Lipo Drops at that time too. It will still be in your system working. So as long as you do it, even if you do it after eating, but ideally you want to do it before you eat so that you get the optimal benefit from it. So at any point before you eat, including right up to the period that you sit down to put that first forkful of food in your mouth, you can squirt the Lipo Drops under your tongue, hold it under your tongue for 2 minutes, swallow it, and then you can start to eat and you will get the same benefit. Great question, Darryl. That might be the question of the day. Okay. Antoine Stenson, should I cut out meat to get rid of inflammation in my joints? You could, but oftentimes meat is not as bad as people think that it is. It's not the culprit that's causing a lot of inflammation. There are other things you can do to cut out inflammation. Vitamin D is your body's natural anti-inflammatory, as well as omega-3 fish oil. If you're taking vitamin D, omega-3 fish oil, and probiotics, you're pretty much going to decrease inflammation best you can and still allow yourself to be able to eat some of the things you might enjoy. There are people that are lacto-vegetarians, which means they don't eat anything if it has a mother or if it has a face. And so these people are really strict. They only eat things that come out of the ground or, grow out of trees. And they can still have inflammation. So there are other things associated with inflammatory conditions, but you can treat the inflammation again with your vitamin D, with your omega-3 fish oil, and you can not have any further issues with that. So I think that again, doing those things, but I would not say don't eat meat if you decide you want to cut out red meat. You still want to eat chicken and fish, that's fine. Some of your fish products, particularly like salmon, are very high in omega-3 fish oil, which are anti-inflammatory and can help as well. Or you can take out lipo omega, which is a good fish oil product that will help decrease inflammation throughout. And then you kind of have freedom to eat more things that you might enjoy. Great question, Antoine. Lisa Moore, good evening. Are LipoDrops Max and LipoDrops Night the same product in a different form? No, indeed. If you look at the ingredients that are on each product, and you can, if you go to the website, you'll see the ingredients that are in each. No, they are different in a variety of ways, including some of the extra things that are in the LipoDrops Nights. So no, totally, completely different products. You can take either or both. I tell people that weight loss is three things. Number one, how much you want to lose. Number two, how quickly you'd like to lose it. Number three, how much you're willing to invest to optimize your weight loss. Everybody wants to lose a lot of weight yesterday. Nobody wants to take the long, slow process of losing 1 pound a week and then, taking a year to lose, 15 pounds. That's just not the way that most people want to do it, and you don't have to. So optimizing this, and in addition to, if you look at the ingredients, the LipoDrops Night even has melatonin in it, which will help you sleep better. So when you sleep better, you burn fat better. When you do not get a good, deep REM sleep where you're dreaming and resting, your body is not resting and restoring. You're not necessarily, you're definitely not burning fat. You might even be storing more fat. You want your body to burn fat or at least not store it. So that's one of the additions, and as far as the nighttime formulation is concerned. But you look at, there's a proprietary formulation of different things that are not in the LipoDrops Max, but in the LipoDrops Night that will help you burn fat as well. So again, burning fat around the clock is optimal. You want to burn as much as you can in the daytime, but oftentimes people say, well, when I'm sleeping, you don't do any real fat burning. But now that we have this LipoDrops Nights product, you can do that as well, and that should enhance your weight loss journey. Great question, Lisa Moore. You are all right with me. Okay, Deborah Truesdale's Westcott Taylor. The new craze in vitamins now is sea moss. Can you please tell me what the benefits of this vitamin is, if any? Sea moss is not a vitamin per se. It's got a lot of good things in it, and we are looking at coming out with a optimal proprietary blend of things that are in sea moss that, one, have been proven scientifically, two, are purified and optimized to give you all the great benefits. It's going to be our Lipo sea moss. And so you will see this product in there. A lot of people are taking sea moss, but you have to be very careful about the source of origin. You have to make sure you know where it came from, who's manufacturing it, the quality of the product, and exactly what it has in it. Just the term sea moss sounds good and natural and all of those things, but a lot of these products aren't natural at all. They are synthetically prepared. So you want a product that optimizes all the benefits of sea moss. Obviously, of course, the things that you get from the sea usually are very, very healthy, and it has a lot of good. The most important key things are the minerals, and things like magnesium, other things that you benefit that really aren't available in the regular diet now. So I tell people every day to take a complete multiple vitamin with iron and minerals, And so it's very difficult to find a product that meets that criteria. It is darn near impossible to get it out of the things that we eat all day, every day, because the quality of food is just not where it has been traditionally, because of the way things are made nowadays, the quality of the soil. We don't let the soil rest and regenerate. As soon as one crop is full, we plant another crop. So it's very difficult to get nutrition from just eating regular foods now, no matter what type of and style of diet. If you're eating clean or any of those adjectives that they use now, it's very difficult to get any substantive nutritional content from foods that are out there and available now, particularly processed foods. So supplements are necessary now to optimize your health, and that's one of those that I think is going to be good for you. Okay, great. So this brings, that was our final question. This brings to a close this episode of the Ask Dr. MJ, your healthcare questions, and we are glad to have answered them. I hope you had a wonderful evening with us. Please go to our website, lipodrops.com. Go to the website right now. We got a special going on the Lipo Night, but other products as well that can optimize your health. Remember, Dr. Collier's Healthy Trio, which is omega-3 fish oil, 1,480 milligrams, one capsule twice daily. The Doctor's D, which is vitamin D3, the activated vitamin D at 5,000 international units per day. The average product over the shelf is 1,000 international units, and that's just not enough to give you the benefit that you need. You'll be taking vitamin D is not doing you any good whatsoever. You'll be lucky if you get in the normal range. If you're starting off at a low level, like less than 10, it's going to take you a year to get to 30, if that, and you're still not where you like to be. And then, of course, the probiotics, God's gift to GI and immune health and all the benefits that you like. Thank you so much for a great evening, and we'll see you next time. Remember, go to the Rickey Smiley Birthday Beach Blowout. That's going to be this weekend. We're going to have a live remote radio broadcast on Friday morning from 6 a.m. until 10 p.m. And Dr. Collier will be giving a presentation over the weekend as well on your health, and an Ask Dr. MJ, Ask the Doctor segment as well. So thank you so very much. Tune in, and we'll see you next time.